In this video, we are going to present you our paper who assessed the effect of lockdowns on the spread of the virus, of the COVID-19. As the world faced for the first time such a pandemic, it's necessary to understand the effect of those lockdowns on the spread of the virus. And as now the world is coming out slowly of this global lockdown, people start to question the efficacy of those measures. And kind of somebody who had her house who burned, or the building, and come back in the house and says, well, but there is some damage of water, the firefighters broke the door, but actually there was no fire in our house. So they question the efficacy of the firefighters because they don't see the fire in the house, so they think that the measures they took were not necessary, failing to understand that potentially it prevented the fire to enter in their house. And it's the same story with the lockdowns measure. People are coming out and questioning the efficacy because in the end the health sector didn't collapse, but potentially didn't collapse with the help or due to the lockdown measures. And hence, measuring the effect of non-pharmaceutical interventions, so lockdowns, broadly speaking, is necessary to understand what happens, was it useful, and to be more prepared in case of future pandemic, to know which measures were more or less efficient, or even if they had an impact, and what's the magnitude, the size of this impact, how many lives have been saved. And as we have seen in the last video, there are many barriers or many difficulties to observe and measure properly these effects. So start by watching the first video to understand what's the problem we try to overcome to properly measure this effect. To the best of our knowledge, this is the first study who assessed this effect with a large set of countries, 194 in our case, and who address at the same time all those issues that might bias the results. So let's see together what we did and what we found.
And you have control of effect and measure what the effect of this
There are three common problems when we try to observe the effect of NPIs on the spread of the virus. Those who bias the estimates and prevent to measure a causal effect are usually omitted variable bias, measurement errors, and reverse causality. And in our case, in this setup, the measures suffer the three types of bias. So we have to try to overcome or address those issues to properly measure this effect. Broadly speaking, we use what we call a linear regression, which this setup will allow us to measure the effects of NPIs on the spread of the virus while disentangling and separating the effect of many other potential factors that might influence the effect we are trying to measure. So the first problem we are solving with our approach is what we call an omitted variable bias. Basically, again, we are trying to observe the effect of NPIs on the spread of the virus, but maybe it's something else that's influenced the relationship we are trying to measure. For example, let's say some countries have a poorer healthcare system, so weaker healthcare system, and those countries might implement stronger lockdowns because they are aware that they have this weakness. And so this is influencing the spread of the virus and at the same time the decision or not to take a lockdown and the strength of the lockdown. So we have something else here, the health sector quality, who is influencing both of our variables. Hence, if we don't take this into account, this is what we call an omitted variable bias, because we omit to take this variable into account and it biases the results. So to address this issue, we are using what we call countries fixed effect. We are taking into account everything that is specific to each country, and we are just looking at the variation within the country. And let's take an example. If we look at this graph, we can see 4 dots showing at different points in time the number of cases in different countries and the strength of their non-pharmaceutical interventions. And we can see kind of a positive trend. The higher the number of the case, the higher are the number or the strength of those lockdowns. But actually what we are doing is looking within the country. Let's say we have actually on this graph two countries. And we can see or make the assumption that country 1 has a poor healthcare system, and hence they have higher number of reported cases, but as well more stronger lockdown measures. And what we do with country fixed effects is that we will look at the variation within each country. And if we do so, we can see that indeed country 1 had a higher number of cases, but also stronger lockdowns. But once they implemented stronger measure, the number of cases was reduced. And we can see the same pattern for country 2. So this is just illustrative, but to show what's the idea and what's the strategy we are using is that we look at the variation within country, taking into account everything that's specific to those countries and cleaning the effect from those specificities. And this methodology, so to control and separate the effects that are fixed at the country level, it allows us to control, for example, the age distribution, the proportion of smokers, the climate, the number of neighbors, the quality of the healthcare system, the number of beds in ICU, and so on and so on. So a methodology that allows us really to get rid of many influencing factors that might bias the results. The second omitted variable, let's say, is more with respect to the timing of the year. So as the year, we advance in the year, so the weather is changing, and also the life of the virus globally is evolving. So in the early phase, you have few countries hit, we don't know much about the virus, then you have really the pandemic phase where many countries are hit, but at the same time, they already had the opportunity to observe what was happening in the first country, the country who were early hit, and to take more decision with more knowledge of the virus. And so their answer is kind of different from the early responders. And then you have the situation where the world is in lockdown. So if you are hit very late, basically if all the world is in lockdown, technically you are kind of benefiting of this spillover effect. If your neighbors are locked, you are kind of locked. So we have to take into account this evolution through time of the life of the virus. And we do this also with what we call day fixed effect. We separate everything that's specific for each day at the global level with the day fixed effect. So typically controlling for the mechanism that I just explained. The second main issue and very tricky issue is what we call reverse causality. Basically, the spread of the virus influences at the same time the decision of the government to take measure and the strength of the measure. So again, for example, as in the last video, if a country is stronger by the virus, they are most likely to enforce stronger measures to stop or contain more radically the spread of the virus. So to take care of this issue, we are controlling for the state of the virus in the country the day before. So this allows us to really use the information that the government have at the moment they take the decision. They observe the state of the virus the day before, and we take this effect into account and separate it from the effect of the non-pharmaceutical intervention, addressing this issue of reverse causality. The last common issue is what we call measurement errors. Basically, we don't observe perfectly well in each country the number of persons who have the virus. So let's say, for example, a country just reports, for many reasons, voluntarily or just by lack of proper knowledge, they just report 80% of the case, of the real case they have in the country. Well, this is not an issue with our methodology because we are exploiting or studying just the variation within the country and the variation in percentages. So let's say a country miss 20% of the cases, so they report just 80% of the cases. Well, we will anyway saw on those 80% of the cases the variation through time and the potential reduction due to the NPIs. And hence, by exploiting within country variation, we are kind of on the safer side. We are kind of addressing this issue of measurement errors. Now I will let our colleague and expert on the data in our team explain how we got those data on NPIs.
Hello, everyone. Today I would like to talk to you about the governmental measures undertaken in order to reduce the cases and deaths from the current COVID-19 crisis. More specifically, I would like to open up some information about how did we deal and how we measure the lockdown policies implemented by governments in our study with my colleagues. We got this question very often about how did we manage to gather this data set and these different categories of measures. So in a simple way, we identified a news headline aggregator, in our case was LexisNexis, and we built a custom-made Java program that was supposed to scrape every news headline that had information about specific country in variety of languages and about specific libraries of keywords that allows us to narrow down which of these headlines are discussing and talking about COVID. The second step allowed us to clean these datasets and identify precisely the effective dates of each type of or each category of lockdown policies that was undertaken, which allowed us to come up with variety of lockdown policies. For instance, one group of lockdown policies were focused on within country restraining movement of people and goods, while other categories were more focused on the international closure of the country towards other countries and regions affected by the COVID. What is very interesting about the data that we have, at least, is that very precisely speaks of the effective dates when each policy was implemented and the earliest effective date for some of them, like partial selective lockdown.
So using our model, we have been able to show that yes, NPIs have been useful to contain the spread of the COVID-19. We have been even able to estimate that approximately 650,000 lives have been saved, so people not dying from the COVID-19. And our model helped us also to compare the different lockdowns measures. And actually what we found is that within country measures were more efficient at containing the virus, the spread of the virus, than measures towards the outside. For example, closing the borders. So the graph that I'm showing right now represents each day after the decision was taken for different measure of lockdown, what's the average variation of the virus compared to countries who didn't implement those lockdowns measures. And hence, when the line is going below the zero line, it shows a reduction compared to the countries who didn't implement those measures. And what we can see here is that actually, again, within country measures were more efficient than measures like border closing, and more specifically the selective lockdown, partial lockdown, so blocking just a sub-part of the country, were the most efficient. And this is a very promising result because it means that potentially we can reduce the economic costs or the disruptive costs of lockdowns if we focus on the most efficient measures that were just partial or lockdown or selective lockdown of the nest of the virus in each countries. And then we studied if the effect of the lockdowns were different between developed countries and developing countries. And what we find actually is that all the effects comes from developed countries, as we do not find a statistically significant effect for developing countries, meaning that so far we do not find that lockdowns measure help to contain the virus in developing countries. And one potential explanation is that it's too costly in developing countries to stay at home. You don't have insurance. If you are a daily worker, basically you face the choice between starvation and potentially getting the COVID-19. And even if developing countries try to raise the cost of going outside and to not staying at home by enforcing prison sentences, large fines, or beatings the people who are going outside, it seems that it's not suitable to lock the whole country down if you don't have proper insurance or ways to reduce the cost of staying at home. And our finding that selective and partial lockdowns are more efficient might help even developing countries to enforce those selective lockdowns, so just a sub-part of the population being locked, while potentially helping them or supporting them with food or monetary support. And as it's just a sub-part of the population, even for developing countries, it represents a smaller cost and potentially more accessible to the governments or to the international community to help for just a sub-region of a country rather than just locking down everybody. So yes, NPIs have been useful to contain the virus. We show that mostly within country measures have been most efficient, and that those measures might be more suitable as well to developing countries because they are potentially less costly. So if you have any questions on those concepts and the research, you can find the paper in the link below, and feel free to ask questions on the comments below. I will gladly discuss with you those results. Thanks a lot for watching, and I hope to see you around and discuss research with you around on the channel.